Hello friends, let us now see the next question in our series MCQ for you. I'm Dr. Amit Desai, I'm a surgeon and I take lectures in surgery and anatomy for FMGE as well as for NEET PG. Alright, so let us look at this question. True about strangulation of intestine is, what do they say? Arterial blood flow is affected first or venous blood flow is affected first, or is the blood flow normal, or is there no gangrene? All right. So let us see the pathophysiology. Now, when we are talking about strangulation, most often it is a complication of intestinal obstruction. It's a complication of intestinal obstruction. Now, what happens in intestinal obstruction? Now, whenever there is an intestinal obstruction, as the name suggests, there is obstruction to the passage of stools, flatus, and other intestinal contents. Okay, so there is obstruction to passage of stools and flatus. So what happens? One thing that happens is there is inability to pass stools. And secondly, what happens is there is an inability to pass flatus. All right. So this manifests as constipation, and this manifests as obstipation. Inability to pass flatus is called as obstipation. Now what is going to happen? Now imagine if you are stuck up in a room which is locked, or if there is a big obstruction, there are rocks over there, you're not going to just sit over there. You're going to try and push those rocks, right? Similarly, even the intestine, the intestinal muscle is going to vigorously contract and try to push open that obstruction. So there is a vigorous peristalsis of the intestine, intestinal smooth muscle. Now, how is this going to manifest? This is going to manifest as colicky pain. Colicky pain. Now, the intestine is trying to push very hard. Okay, the intestine is trying to push very hard. But what is happening is, what is going to happen is that the uh, person, what will happen is that the intestine that is moving, it will not be able to push open the obstruction. So two things are going to happen at this end. Okay, one is that because of the juices, because of the gas, everything that is collecting, there will be distension of intestine. And secondly, what will happen is now the intestine will get tired and it will start having what is known as reverse peristalsis. Reverse peristalsis. Okay, peristalsis in the opposite direction. As a result of which, this will manifest itself as vomiting. This manifests itself as vomiting. And this will manifest itself as abdominal distension. So the five things that you will get in any intestinal obstruction is inability to pass stools, that is constipation, inability to pass flatus, that is obstipation, colicky abdominal pain, distension of abdomen, and vomiting. Okay, so it might vary according to where the obstruction is, but these are usually the five things that you will get in a case of intestinal obstruction. Now, when the intestine starts getting distended, what will happen is that there will be increased pressure on the wall of intestine. There will be increased pressure on the wall of the intestine. Now, because of this increased pressure, first thing that will happen is that there will be obstruction of the lymphatics. And because there is obstruction of the lymphatics, what will happen is lymphedema will be taking place. And not only will there be lymphedema, the junction between the two cells that will start getting separated, and this is going to allow the translocation of bacteria. This will allow the translocation of bacteria. As the pressure goes on increasing, as the pressure goes on increasing, the next thing that will get obstructed is the venous flow. The venous flow gets obstructed. Okay. And when the venous flow gets obstructed, it will give rise to ischemia and gangrene. This is what we call as strangulation. This is what we call as strangulation. And of course, once there is gangrene, this will give rise to perforation. And once there is perforation, there will be peritonitis, which can be fatal. It can give rise to septic shock and death. So, what is the first thing to get obstructed? It is the venous flow. It is the venous flow that is getting obstructed. All right. The first thing to get obstructed is the venous flow. And hence, in this, our answer is B. Venous flow gets obstructed first. All right. So, if you like this video, please subscribe to our channel ADSL Academics. Please press the like button and also press the bell icon so that you will get notification of all the various videos that we are doing.